This Wheelie Good Tip is brought to you by Permobil. Thanks guys for your support.
So first and foremost, we'll talk about male sexual function, which is erection. That is important for sexual intercourse. The second thing is around ejaculation. Again, that is important for fertility. And the third is around orgasms, which we have after a sexual intercourse as such. So unfortunately, after a spinal cord injury, there is quite significant changes in all these three functions. So to answer your question, yes, life will be different compared to how things were before. But there are lots of different things we can do in order to support you in your exploration of sexual function along with your partner. And it's not all about sex, right? It is about companionship. It is about being together. And all those aspects are really very important. So if I start off with the erection function of male fertility. So after a spinal cord injury at your level, usually the erection will be lost. The penis is usually flaccid because of the level of your injury. So this is what we call as a lower motor neuron injury. And if the injury is slightly higher up, T10 and above, usually people have got some sexual function or erection preserved, but that is not in their control. So in that situation, there are certain medications which help to get the erection stronger, and that can be utilized in sexual intercourse. There are various websites which I can give you some information on, and you can get more information there. But to start with, the blue pills obviously have been in the system for some time. They were initially introduced for trying to lower the blood pressure in the elderly population. And it was quickly known that the sex life of the elderly got very interesting after that. So the key things with these, it's a mouthful, PDE5 inhibitors they're called. But essentially these are medications which help to increase the blood flow in the penis. And this then causes the erectile function to be a bit stronger. And in some, that is sufficient for sexual intercourse. Side effects are usually headache because it can lower your blood pressure a bit. People also talk about jaw tightness, pain, discomfort. Some people also talk about burning, gastritis kind of symptoms, heartburns, and some may even have some diarrhea. But it is very well tolerated and is something which we quite commonly use in post-spinal cord injury. And so we would recommend the second line of attack, so to speak, if the pills are not sufficient, is to try erect aid pump. What is it? I have a sample of it here which I can show you. So if you see, this is obviously a model of a penis. It's pink in color, unfortunately. And you put the pump in there and create a vacuum. And this, along with the medication like Viagra, may be able to support the erection better. There's one disadvantage to that, is that it has got a what we call as a tog effect, because the penis is stronger here, but at the base it can be a bit limp. And this means chances of the penis coming out from the vagina, all those things are there. But some patients swear by it and have used it and find this to be very useful. See, it depends on the level of your injury. So if some people who have got injuries at T6 and above, we need to be mindful of autonomic dysreflexia. And also if they application is for too long, there is a chance of bruising, and it can also cause significant damage as such. So this is something to be monitored. And if one has got a tendency to autonomic dysreflexia, in this situation, we should be cautious in using these devices. But I know of patients who have got injuries above T6 and using this device quite successfully, just being mindful. So these are the kind of mechanical things we can do in order to support that erectile function. In this situation, the best solution is to be looking at what we call as injections to your penis. So this is, it comes, as you can see here, in this pre-packaged vials. There is a syringe attached to that. In the newer models, what we have is you can actually dial the dose. So they come in various strengths. So 10 micrograms, 20 micrograms, 30 micrograms. What we would recommend is that we first trial the lowest possible dose. In my practice, I would do 5 micrograms to begin with. And this is done in supervision. So it is done in the hospital setup so that we can monitor the side effects. And one of the major side effects which we have with this injection is a condition called as priapism, which essentially means erection lasting for greater than 3 to 4 hours. This is a medical emergency because it can actually destroy the penis completely. And most of the times it needs to be dealt with very quickly. Cold compress helps. There are certain medications we can give, and we may have to draw some blood from the penis in order to get the penile penis deflated a bit. So again, very good tool, but it is something to be aware of. And lots of the times you go gradually up 5 micrograms, 10, 15, 20, till you find that right dose for you. It also depends on the level of your injury. But here we normally prescribe this for lower motor neuron, as in L1 and below. And here the penile sensation is usually not that big or good. So injections are usually well tolerated. Again, you need to learn the technique. You've got good hand function, so you should be able to do it yourself. Or your partner should be able to learn how to do this quite easily. Okay, so these are the various devices and aids in order to help you with your erection, which is important, as for sexual intercourse, this is really the first thing we need.